Morning. We will call our subcommittee meeting to order. The first bill that we will consider is Senate Bill 2873. And we won't be reporting bills out, so we can kind of consider this as an informal discussion. The first bill, Senate Bill 2873, short title is to provide medical records retention requirements for hospitals, physicians, and dentists, and for related purposes. Just in general, the bill proposes a 10-year retention period for hospitals in the instance of graphic matter, images, x-rays. It shall be a minimum period of 3 years from the date a patient is discharged. Then over on page 5, it's the same proposed language for dental records. And on page 7, the same provision for medical records as it relates to physicians, I would say doctors' offices in general, those who are governed by the State Board of Medical Licensure. And so do we have anyone here who would like to present and discuss this matter for the committee? Are there any comments from members or questions? Oh, I didn't see you. I'm sorry. Yes.
I'll be happy to.
Please feel free. If you can come to the microphone.
Thank you, Madam Chairwoman. I appreciate it.
And if you would, please provide your name and an introduction. We are live streaming also.
Got it. My name is Dave Estorge. I'm Chief Operating Officer at St. Dominic's, a part of the Franciscan Missionary of Our Lady Health System. And we are bringing this bill forward for y'all to consider. Here's the situation as we understand it that's going on, not only at St. Dominic's, but across the state, specifically as it relates to physician records, okay? State law in Mississippi is largely silent as it relates to the retention of physician records in Mississippi. Therefore, you have hospitals that own physician groups and other physician offices who are retaining records for an undisclosed amount of time, really infinity. I've heard that there are floors that are collapsing because there are medical records stacked up in these places. And what we are trying to do is modernize this law to reflect what is going on in at least 10 other states who have gone to a 10-year record retention similar to what Medicare requires for physician records and our managed care programs. Also, for hospitals, Mississippi state law is 28 years. We are trying to move that to 10 years to be consistent. This would create a lot of, I think, reduce a lot of angst amongst providers in the state, would allow us to get out of leases where we're storing some of these medical records. And that really is all I have to say about the bill.
Are there any questions or comments from members of the committee? Senator Blackwell.
Thank you, Madam Chairwoman. I noticed this, the part with that might pertain to radiology. This is on page 7, and it refers to physician. Now, is that physician by group, or because there's other entities that might, like a freestanding imaging center, that might have these store these images as well? Does this pertain to them as well?
That's my understanding. But if there's always the opportunity, of course, to clarify that, we would have no, obviously, objection.
From council.
I think the reason it was put there is because that's the State Board of Medical Licensure chapter. I think probably the better place to put it, if you're trying to include, other facilities.
Yeah, I would just make sure, because you got orthopedists that have ownership in MRIs, cardiologists and neurologists with CTs. So just to make sure that we encompass those groups, because it won't necessarily an individual physician, but certainly supportive of the concept. Just want to make sure we don't exclude anybody.
So in light of that comment, I guess I have a question. The groups that Senator Blackwell just mentioned, would they all be covered by the State Board of Medical Licensure?
No,
That
not
would
in
be
that specific
excluded?
chapter. Section 1 talks about hospital records. I think we could amend that and say the hospital records or other. Maybe.
Does that address your? Are there any other questions? Senator DeBar?
Thank you, Madam Chair. And I don't know this, maybe, Madam Chair, you can answer this, Mr. Estridge. 10 years just seems like an awful long time to maintain records. I know we don't have to maintain our legal documents that long. Is that, and I think you may have answered this, is that the ordinary course of business, 10 years, or why is it, should it be shorter? I mean, you're asking for 10 years here, I guess, but I guess that's correct.
At a minimum, I think HIPAA requires us to retain them for 7. And so again, there are some managed care companies in the state of Mississippi that ask us to retain records for 10. So we're just trying to be consistent. Of course, we'd like to have it at a shorter time frame. But as we've interacted with physician groups and other interested parties in this, 10 years seems to be the comfort level that everyone has with this bill.
I have a question. I think based on what I read, existing law regarding graphic matter is 4 years. And then there is a provision to provide notice using the last address that was on file with the facility prior to the destruction of those records. And that is not included in the bill. So my question would be, if the bill is adopted into law, would there be any efforts made to provide direct notice to patients that are currently, well, records are currently in existence before they're purged or destroyed? Okay.
Okay. I don't believe that would be the intent of this particular issue. One of the things that we did on the hospital retention bill is if a longer period of retention is needed, that the family or next of kin could contact the hospital and ask for a longer period of time to reserve that record.
And also, the question would be, if this is adopted into law, would there be any efforts to, before the hospital or any of these facilities purge their records, to some sort of notice, advertisement, or public messaging to let people know that they could possibly request their records before they're disposed?
Here's the problem as I see it, okay? This is more of a problem on the physician side than it is on the hospital side. What you saw on the hospital side is a lot of these records were converted into electronic health records. If we were to put that in there, and I can speak for a number of different physician groups, there are piles and piles of records. It would be difficult for someone to actually locate that exact record. I think it would be a difficult promise to live up to at this point, especially given how far you would have to go back. I couldn't speak to the condition of those records at that time, because remember, we may be going back all the way to 1985, for example. And a lot of these records, in some cases, I'm not speaking for FMOL at this point, but I am familiar, they've not been kept in climate controlled areas. They may have been damaged. And I think that would be a really difficult thing for providers in the state to be able to do.
Senator Blackwell.
Thank you, Madam Chairwoman. Just to comment, in the imaging world, we're required to hold images for 7 years currently. And as it relates to minors, at least 7 years are up to the age of maturity. And I'm wondering if we might not need to have that language in there for minors to protect them in some form or fashion. But typically when we purge our records, there is no notification. It'd be timely and costly for providers to do that. But I don't know if we might want to take a look at the adolescents, other, I don't know, Dave, how you feel about that.
It would be better than what we have right now. So we would be thankful personally for whatever y'all could do. I know that we had not put in there and not carved them out because that could potentially increase the duration in which records would have to be kept. And so it might be confusing for entities. It might require facilities to go back through all of the records and say, okay, what's the age of this person? You know, so it would make things more complicated on the shredding and disposal side.
If there's a savings for minors, is that that's what you're? Any other comments or questions? Any final comments from you? Is it Etheridge?
Other than thank you for considering this bill. We appreciate y'all.
Thank you. We appreciate your time today. Are there any other comments on this particular bill, 2873? We'll go to the next bill before the committee. Well, I guess let me ask this question. Now that we've discussed the legislation, do we have any proposed modifications? I said, now that we've discussed Senate Bill 2873, do we have any proposed modifications to the language?
I'll reserve comment until the committee, I'll get with council.
Thank you. The next item is Senate Bill 2886. The title is lengthy, but I think that it's been generally referred to as creating a registry for vapor products. ENDS product, I think is how it's been referred to. And so we'll start with that. The registry would be administered by the Department of Revenue and would require that vapor products be basically, there be a certification and that must be on file with the department or those items can be seized. So is there anyone who would like to present to the committee on this issue?
Good morning.
Good morning.
All right. And thank you for allowing me and Celine is passing out some more in-depth information on this bill. But as Madam Chair said, what this bill does is Mississippi is being flooded by illegal vapor products. And there's no way for wholesalers or retailers to determine what's a certified product and what's not. So a lot of these products, in fact, the ones that are being sold in the state that are not legal products are banned. They're made in China, and they are banned over there. They're not even legal in their home country, but they're coming over here. So what this bill does is just makes it doesn't restrict any manufacturer from selling in the state. So this is not impeding commerce. It's just saying if you want to sell these products in Mississippi, then you need to be certified. And the FDA is the certifying entity. And if products are manufactured in America and they're certified to be sold, So if your product is a legal product, then it should be certified also. So what this bill just says is make a registry or a list of certified. So when DOR comes in and do their examination, your name is not on the registry. There is a format to get registered. It does not find you immediately, but there are violations if you come in and they give you the time and the method to get certified and you don't, then there's a process of remedies after that. It could result in fines, but that decision is strictly in the hands of DOR in this legislation.
Are there any questions from members of the committee? Senator Blackwell?
Thank you, Chairwoman. Does this require any testing of these products or any COA, certificate of analysis?
It does not require from the state. What a method FDA uses to certify the product, I don't know, I'm sure it would, because there is a process to become certified to sell in it. But I say that decision is made by FDA, how they certify the products. But that won't require any testing on down here. I mean, once you get it in Mississippi, it's strictly a registry, maybe several hundred, or it could be less than 100, but it will list what products, vapor products, are legal to sell here. And if you have products on the shelf that are not on that list, then you follow this process of what the violations will do.
Senator Barr?
Thank you, Madam Chair. So what is, you say they're illegal vapor products. What makes them illegal? Are they tainted or are they just not running through the FDA, or what's the issue here?
Yeah, the issue is, you said exactly right. It is not an approved product by the FDA.
Okay, so how are they being sold here and purchased here then? Are they just bought off the black market or something? Is that what?
Just direct ship.
Okay.
Yeah, there's no point of inspection. Is that right, Senator? As you understand it, you can't just direct ship them from China to a distributor or to the end seller himself, but they can buy them direct without going through the FDA process. This just assures that your product goes through the same process as the legal companies in USA. If they have to be certified and go through FDA to be able to sell here, we're asking the same thing. Not saying you can't, just go through the same process the legal companies go.
So what if a company or a store or whatever violates this? What's the consequences for this?
It's in the bill. But the first issue is, I think there's a warning, and then it's got a first, second, and third violation of what happens, and you can be fined. But I think the first one is just a warning in the bill.
That's at page 201, Senator.
Thank you, Madam Chair. Okay. So with the registry, I mean, so what you're saying is this is going to keep or ensure that we have FDA tested products that are for sale, and then limiting or eliminating those that are not. That's
Yes.
what this does. And
That's right, Senator.
there's consequences for the retailer as well as the shipper or manufacturer of the
Right.
product
Right,
failing to do so.
right.
Okay.
But there's a process to get legal. You can go through it and then get the name on the registry.
Okay. Do you know how prevalent is this issue? Is this something that's in 82 counties we're having this issue, or is it maybe affecting a small population of their state or citizens, or what's the?
It is prevalent quite a bit, and it's quite prevalent among our young in the state. That's why we want to make sure that if it's going to be sold, it's legal to be sold, then you need to go through the proper process.
Okay.
And other states have already approved this. I think we said Alabama, Louisiana, Oklahoma, and Wisconsin have already implemented similar registries. So it's just a list. So you got 25 products that you're selling, and 5 of them are not on the registry, then you go through this process of what it takes to get registered.
And I believe you stated already, who would maintain or the registry? The health department or who's gonna, how's the registry? Who's gonna maintain?
DOR.
DOR,
Mhm.
okay. Is that something they'd have to create? Is there a expense or to this creation and maintenance of the registry?
Well, it definitely would have to be created.
Okay.
Now, the fines also go to DOR also.
Do you know what the other states that have implemented this, what it costs them annually to operate and maintain this?
I do not, Senator.
Okay. Has it, from your, I guess, investigation or experience, has it reduced the, I guess, the shipment in of these black market vapors or untested vapes in these other states that have implemented this registry?
It is my understanding it is very effective.
Very effective?
Yes.
Okay. All right. Thank you. Thank you, Madam Chair.
Welcome, Senator DeBar. Are there any other questions? Comments from anyone?
I think we need to find the cost of something to maintain this. If it's, I don't think the cost should be, it's going to be prohibitive, obviously, but I think it's something we need to know for sure as we move down the line here.
That's something we can work on to try to pull together for next week before it goes before the full committee. Anyone, any other guests here who would like to present or talk with us about this particular bill? Well, thank you. I won't say that we'll report these out, but we will rise and report if there is such a motion. Rise and report. Thank you.